Hello and welcome to Tennis Conditioning TV. In today's episode, I will talk about rotator cuff injuries and how they can occur, since many tennis players encounter shoulder problems throughout their career, sometimes so severe that they have to end their career prematurely. I will talk about structural aspects of the shoulder joint, common rotator cuff injuries and how they can occur, signs and symptoms, treatment options, and to the end, exercise recommendations. The shoulder joint, also called glenohumeral joint, is a multi-axial ball and socket joint, also referred to as diastrophic joint, that has the greatest movement capabilities of all joints in the body. Because of its superior movement capabilities, it lacks stability. Stability is sacrificed to enhance mobility. Even though it is a ball and socket joint, the glenoid fossa, meaning the socket portion, is relatively shallow and the ligaments are lax within normal movement ranges. Therefore, other structures are needed to keep the humeral head, meaning the ball portion of the shoulder, in place. The structures that contribute to stabilize the humeral head are cartilage, ligaments, muscles and tendons of the rotator cuff musculature, which are the supraspinatus, infraspinatus, teres minor, and subscapularis. The most common injuries are shoulder dislocations and tears or inflammation to the tendons of the rotator cuff muscles. Shoulder pain is generally caused via impingement or tendinitis. Scapular impingement or inflammation of rotator cuff tendons caused by micro tears. The rotator cuff muscles are small compared to the deltoid or biceps and hence require adequate strength and endurance to ensure proper functioning of the entire shoulder joint. Now, due to prolonged and repetitive activities, especially overhead movements like serving, the small rotator cuff muscles cannot maintain dynamic stability due to muscle fatigue and/or other factors such as muscular imbalances, poor technique, inadequate warm-up and conditioning. All these aforementioned factors can lead to rotator cuff tendinitis or rotator cuff impingement. Rotator cuff impingement or scapular impingement occurs due to pressure caused by the acromion when the arm is lifted, such as this, again like this movement up here, because the acromion rubs onto the surface of the rotator cuff, causing pain and limiting movement. Sometimes the bursa just over the rotator cuff can be inflamed as well and hence causing pain. Generally, an individual suffering from rotator cuff injury will experience one of the following: pain when the shoulder is moving or at rest, stabbing pain when lifting or moving objects, or third, the pain center is moving from the front to the side of the shoulder. A variety of treatment options are available, surgical and non-surgical. Today, I'll be focusing on the non-surgical options. Initially, athletes are advised to stop any overhead activities such as serving and rest the shoulder for days or weeks, depending on the severity of the pain, and anti-inflammatory medication generally accompanies the rest period. If the pain is more severe, cortisone shots, meaning injections, can be applied to the affected area, such as the bursa. Once the athlete is pain-free, a physical rehabilitation or strengthening program is incorporated regularly, oftentimes in the form of a dynamic warm-up using elastic bands. Next, I introduce some strengthening exercises with an elastic band that you can do to enhance strength and endurance of the rotator cuff musculature. Well, that's it again for today's episode. As usual, opinions differ. What's your point of view? Let us know below in the comment section. A brand new episode will be available next Sunday. So make sure you don't miss it and subscribe. In the meantime, I recommend you watch some of the previous episodes. You should really watch them all. If you like what you saw, tell your friends. I'm sure they will appreciate it. I'm Philipp Halfmann. Thank you for watching and auf Wiedersehen. Tennis Conditioning TV episodes are licensed under Creative Commons. You are welcome to link or embed these videos, forward them to others, and share these ideas with people you know. Brought to you by Advanced Concepts of Strength and Conditioning for Tennis. Available at tennisconditioningbook.com. Music by Dan O at danosongs.com.